Hi, everyone. My name is Alexa Artiaga, and welcome to my final project, um, my philosophy of health education and promotion, that will actually be marking the end of my first semester as a graduate student. I first discovered this for the degree of health education and promotion as an undergraduate student after taking personal and family health, and really just fell in love with health education. Now, to set up a basis for this presentation, let's define what exactly health education it is. According to the Joint Committee in 2012, health education is defined as any combination of planned learning experiences using evidence-based practices and/or sound theories that provide the opportunity to acquire knowledge, attitudes, and skills needed to adopt and maintain healthy behaviors. And this is important, I think, especially within the field of medicine, because it is so crucial to not only give our participants and patients the information that they need to make healthy choices, but also give them the skills to be able to maintain these healthy behaviors and turn them into lifelong habits that we truly are making a long-term and sustained impact, not just at the individual level, but on society as a whole. And that is something that is really guiding my health education philosophy that I hope to use as I progress in my career as a health education specialist. So, the purposes of this program is to outline my professional philosophy of health education and promotion, while also highlighting the key values and beliefs that guide my approach. In my approach, I more so follow the holistic definition that is also been defined by the World Health Organization Constitution all the way in 1947, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And the reason why I feel like this definition is so impactful to my philosophy is because it highlights the multidimensionality of health. And the need for a symmetrical approach to health education where we're putting equal value on each aspect of dimension of health, whether it be physical, mental, social, or occupational well-being. And that directly coincides with my philosophy that you can see right here on the left. Health is a major constituent of being able to live a happy, long, and fulfilling life. However, access to education and resource varies. As a future health education specialist, it is my duty to evaluate community needs and plan culturally relevant health programs. Our goal as health educators is to increase positive health behaviors, leading to lifelong practices that decrease disease rates and improve quality of life. And you can even see this reflected in the name of our college, Health and Human Performance, that we are really looking to increase the health and the quality of life of the individuals that we are working with in our priority populations, um, to reach a state um, of fulfillment and well-being within the individual. And this is largely impacted by our human performance and the behaviors that we do or do not engage in. So now, with the rest of this presentation, I'll be discussing the importance of customizable health strategies, prevention focus, cultural competency, and the empowerment of individuals through informed decision making, and how all of this supports my health philosophy that we can see here. So the first thing is that health education is so crucial in addressing the root causes of health issues through education and promotion of positive health behaviors. This means that rather than focusing solely on treating diseases, health education aims to prevent them by teaching people how to maintain healthy lifestyles. And we can actually see that promoting health and preventing disease are major objectives for the health of the nation, according to Healthy People 2030. And this really marks the switch within our medical system as a whole from looking at non-communicable diseases to, sorry, communicable diseases to non-communicable diseases. Because now largely the leading causes of death in the United States are due to chronic diseases such as cancer, heart disease, stroke, and diabetes. But interestingly, according to Cottrell et al. 2023, the leading causes of death in the United States are actually due to modifiable behaviors, which are behaviors that we as individuals have the power over changing. The top three causes are tobacco use, poor diet, and lack of physical activity and alcohol consumption. And this just really shows that by improving our health behaviors, we can significantly reduce the consequences of health disease. And especially now in the United States with escalating healthcare costs and an aging population, it really highlights the need to focus on preventative health education because that will allow us to significantly reduce the incidence of chronic diseases as well as um, overall contribute to community well-being by addressing these important modifiable risk factors such as diet, exercise, and substance use. And we as health educators can really use this a preventative approach to increase the health and sustain those long-term health behaviors that we are hoping to implement. Next is our cultural competency. I believe so strongly that cultural competency is an essential part of health education in order to effectively reach a diverse population. Understanding and respecting the cultural differences that we have, especially in the United States, allows health educators to create more relevant and effective programs. The United States as a country is becoming more and more diverse, with the United States Census Bureau reporting that the white population is aging and has actually reached its smallest share of the population's country in history. So we've even seen increased racial and ethnic diversity within the 2010 and 2020 um, US Census, and we're only going to continue to increase as immigration in and out of the United States also increases. And because different communities have unique health beliefs and practices, this really is important to be considered when we are designing different health education programs, whether this is that we're going into the community when we're conducting a social diagnosis and understanding what the community feels is an important health issue to address, or even understanding the cultural nuances and being respectful of them, or properly translating our promotional materials. All of this is such an important part of health education. And I believe in this so strongly that I even graduated from the International Scholars Program this spring 2024 within the University of Florida, because I do so strongly believe that being a global citizen is such an important and crucial aspect of being an effective health education specialist. And now I want to talk about the supporting philosophies that align with my health education philosophy, and that is the eclectic and decision-making philosophies. By combining different approaches and empowering individuals, health education can ultimately be much more effective. So, according to Cottrell et al. 2023, the eclectic philosophy describes a health education approach that says that you should use whichever approach is going to be most appropriate for the specific situation and specific intervention. Because depending on what population you're working with and what setting you're working within, it might require different approaches in order to be most efficacious. Therefore, it's really important for you as a health education specialist to be adaptive, flexible, and resourceful in order to achieve the best possible outcome within your target population. And a great example of this can be seen within the lab that I work with at UF. And here I'm actually pictured with two of my research mentors within the sexual assault and alcohol abuse prevention research lab here at the University of Florida, where we work with two different populations. And one is college undergraduate students, while the other is actually Air Force cadets. And the way that we approach these two very different populations within our research questioning is incredibly different because the way that you approach these two different populations, even within a similar topic, is going to be different in order to be the most efficacious in approaching and working with this population, and also to be able to approach the topic in a way that's going to be most conducive to having that open conversation with the population at hand. And next, philosophy I wanted to talk about is a decision-making philosophy. So this can be included in using simulated problems, case studies, and scenarios that allow individuals to choose the best approach and therefore practice their decision-making skills. And this allows individuals to be able to choose the most ideal health choices for themselves. And this can increase not only the knowledge, but also the self-efficacy of the individual, which will allow them to continue implementing that desired health behavior far past the program and just overall increasing the sustainability of those health education efforts. And overall, by incorporating these philosophies and targeting multi levels of influence, we can create far more impactful and long-term change. So, in conclusion, my professional philosophy of health education and promotion is deeply rooted in the belief that health is a major constituent of living a happy, long, and fulfilling life. As a future health education specialist, my goal is to evaluate community needs and implement culturally relevant health programs that empower individuals to make informed decisions about their health, to be armed with the skill set and the knowledge to be able to continually engage in healthy behaviors until they become lifelong practices and habits, and to actively choose that choice every time and have the self efficacy to do so. My personal values include honesty, trustworthy, and respect. And these are all essential for building strong relationships with the community I serve. Really, those are the foundations of any relationship, both personal or professional. And my journey towards this philosophy has really been shaped by both my educational experiences within my undergraduate and master's degree program, the internships that I've carried out, for example, working at a simulation center, directly engaging in those decision-making philosophies. Um, as well as my work as a research assistant with the SAPR lab. And all of these have reinforced the importance of personalized health strategies, of practicing empathy when you're working with different populations, um, knowing the nuance and working with the culture of within your target population, and listening to their needs and the changes that they want to see in their community, all of which are extremely crucial to having a good relationship with your community that you're working with and overall having a good outcome. Health education is not just about preventing disease, but it's about promoting overall well-being through informed decision-making and community engagement. And by focusing on these multi-levels of influence and targeting diverse populations, we can create impactful and sustainable programs that improve the quality of life, not just for the individual, but for society at large, which really should be the driving motivation and factor for all health education specialists. Moving forward, I'm committed to continuing my work in health education, especially as I prepare to take the CHES exam this October. And I'm hoping to continue working with a focus on substance misuse, sexual assault prevention, as well as increasing access to health resources for underserved communities. I look forward to connecting with my peers, learning from diverse perspectives, and working with diverse group of teams, and contributing to the field as a health education specialist. Here are all of the references that I used to create this presentation here for you today. And most of all, thank you so much for listening, and go Gators!